Hello everyone. Here's the video regarding new updates 2024 to 2025 for the competitive exams of 25, be it NEET-PG, INICET or FMGE. These are some of the most new recent updates which have been updated in the year 24 to 25. We'll make it in 2 or 3 parts. Let's begin with the first part. The first one is the FDA approval of new drug Tirzepatide. So what exactly is Tirzepatide? It is a dual GIP GLP-1 analog. It has been recently approved for 2 indications, one of them being obesity. It is an option for managing overweight and obesity alongside a reduced calorie diet and increased physical activity. However, in which individuals is it recommended? That is the one of the potential questions. It is indicated in individuals who have already an initial BMI of at least 35 kg per meter square. Also, there should be another coexisting weight related comorbidity in this patient. We can, however, we need to remember that a lower BMI thresholds of 32.5 kg per meter square is used for people from South Asian, Chinese or other Asian, Middle Eastern, Black African or African Caribbean ethnic backgrounds. So when exactly do we need to continue or when do we need to stop Tirzepatide? So if even after 6 months of starting Tirzepatide, there is not much weight loss, say only 5% of weight loss or less than that since 6 months of initiating it, then we need to stop the drug. So how exactly does Tirzepatide act? The mechanism of action: it acts through GIP and GLP-1 receptors. Through GIP, it increases LDL activity, also increases insulin and glucagon hormones. The others like decreasing the need for food intake, also increasing weight loss in that process. Through GLP-1 analog, it acts on pancreas to increase insulin. However, we need to remember that through GLP-1, it decreases glucagon, unlike through GIP where it increases glucagon. On stomach, through GLP-1, it decreases gastric emptying. So basically, by decreasing gastric emptying, it is giving a sense of fullness and hence reducing further intake of food. Also, it is cardioprotective, and through the same indication, through central receptors, it decreases food intake and increases weight loss. Some other actions of Tirzepatide are given there, which need not be remembered. So what is the other indication for which it had recently been approved? It's for obstructive sleep apnea. First medication, Tirzepatide is the first medication for obstructive sleep apnea related linked to obesity. There were no other drugs which were FDA approved for this indication. It is potential game changer because it offers an alternative to traditional CPAP therapy. Consider using a CPAP machine every time you need to go to sleep. It's so cumbersome, right? So, however, Tirzepatide offers as an alternative to individuals who tolerate it well, and there have been many trials after which it has been approved. We can see that it changes the apnea hypopnea index compared to placebo significantly. Through these have been done through 2 trials, and after which it has been approved for the indication. Going on to the other important recently approved drugs for 24 to 25 session, we all know that cancer causes significant weight loss due to cachexia, which is also called as cachexia, through various mechanisms. So there has been a recently approved drug called ponsegromab, which targets GDF15, and this combats cancer cachexia. So through GDF15, it potentially reduces weight loss and helps reduce morbidity as well as mortality in cancer patients. There's one more drug, nafithromycin, which could be asked and is a very potential question for the further exams because it is India's first indigenous antibiotic. It's a macrolide antibiotic which has been approved for community acquired bacterial pneumonia caused by drug resistant bacteria. So it has been said that it is 10 times as effective as azithromycin, and hence it can be a potential game changer going forward. Moving on to the next drug for the 24 to 25 session, olezarsen. It's an ApoC3 directed antisense oligonucleotide which has been approved for familial chylomicronemia syndrome. We all know that there was another drug, mipomersen, which was also an antisense oligonucleotide which had been approved for familial hypertriglyceridemia. However, it was withdrawn because it had potential cardiovascular as well as liver toxicities. So we need to remember olezarsen has been approved for familial chylomicronemia syndrome recently. Another important potential question under the category of recently approved drugs is the new regimen for MDR-TB. This has been followed for under our national health programs of NTP, National TB Mukt program basically. So this regimen includes BPAM, that is bedaquiline, pritomanid, linezolid and moxifloxacin for all the MDR-TB patients. So there have been other recently approved drugs which you can go through in our 20th notebook part 2 where we have listed all the important drugs under one table. So these are some of the most important ones which can be potentially asked in the exams. Moving on to the next one. STI kits has always been a favorite for especially INI. However, there has been a new kit introduced under NACO or NACP. The kit 8. Initially, we all know that there were 7 kits. The kit 8, however, is for a new indication, anorectal discharge. We all need to know which are the etiological agents causing anorectal discharge. So, Neisseria, gonorrhea, chlamydia, trachomatis, and M. genitalium and HSV cause proctitis. However, Shigella, Campylobacter, Salmonella, and CMV, along with amoebiasis, cause proctocolitis. Basically, CDC recommended treatment options for anorectal discharge syndromes cover the following infections. We need to remember that cephalosporins cover Neisseria gonorrhoeae, doxycycline and erythromycin cover chlamydia, cancroid is covered by ceftriaxone and azithro. Syphilis is being covered by doxycycline, erythromycin, or primarily by benzathine penicillin, which is an intramuscular single dose injection. For genital herpes, we need to remember that we need antivirals, acyclovir or valacyclovir. So what does the kit 8 exactly contain? That it targets the etiological agents of anorectal discharge. Basically, you can see that if we include cephalosporin, we will be covering Neisseria. If we include doxycycline, we will be covering chlamydia and syphilis. And cephalosporin also targets cancroid. So giving 2 drugs in our kit potentially targets the 4 major etiological agents for anorectal discharge syndrome. Neisseria gonorrhoeae, Chlamydia trachomatis, cancroid, and syphilis. So, our STI color coded kits under NACP. The kit 8 contains tabcefixin, which is a stat 800 mg dose, along with doxycycline, which is given for 7 days, twice a day, 100 mg drug. So basically targets 4 etiological agents for anorectal discharge. This is also a potential question considering how frequently STI kits are being asked in the exams. So some other PSM updates which you need to remember are India has been recently declared free from trachoma on 8th October 2024. In Nikshay Postal Yojana, the government has increased the incentive for basically portion, which is nutrition, for the affected individuals from 500 rupees to 1000 rupees. Ayushman Bharat has been renamed to Ayushman Arogya Mandir. National Health Mission has been renamed to Prime Minister Samagra Swasthya Mission. In Matra Vandana Yojana, the incentive of 5,000 has now been given in 2 installments compared to prior 3 installments, where we give 3,000 after the first ANC and 2,000 after child birth and 14 weeks of immunization of the child. Next, moving on to the 5th one, which has been the hot topic after being declared by the parliament in 2023, and it came into force in 2024, that IPC, all the Indian penal codes, have been replaced by Bharatiya, Nyaya, Sanhita, BNS. So what exactly are the changes in BNS? So compared to IPC, where there were 511 sections, we have 356 sections under BNS. The 175 have been amended, 8 have been added, and 22 have been repealed. Repealed in the sense they have been removed. They have also included new offenses, which include organized crime, petty organized crime, terrorist act, hit and run, mob lynching, hiring children to commit offenses, sexual exploitation of women by deceitful means, which may include promising her to marry, snatching, abetment outside India, publication of fake or false news. However, they have also deleted the previous offense of attempt to commit suicide under IPC. They have introduced new chapters called inchoate offenses, under which we have attempt, abetment, and conspiracy. Also, offense against women and child have been included. New punishment has been added. Community service, which has been introduced as one of the punishments in section 4 of BNS. It is basically provided for 6 petty offenses like non-appearance in response to proclamation, attempt to commit suicide, petty theft on return of theft money, defamation, misconduct in public by drunken person, to compel or restrain exercise of lawful power of public servant. So basically, these are some petty offenses. However, they should not go unpunished. So the basic idea behind this is to give a sense of feeling that the person has committed a offense, though it is petty. So he has to do a community service against that. New definitions have been included for child, for transgender, under gender. They have also included electronic and digital records under the definition of document. They have replaced term mental illness with unsound mind, and they have redefined sedition, which is the act of endangering national integrity. The important BNS sections which you need to remember are, according to the offense category, which have been listed here. Criminal responsibility comes under 20 to 24 sections of BNS. Consent comes under 25 to 30. Sexual offenses under 63 to 79. You need to remember the sexual offenses BNS. Also the criminal abortion BNS, which comes under 88 to 92. Offenses against child have been included under 93 to 99. Offenses affecting life under 100 to 113. Remember grievous hurts sections, which come under BNS 114 to 125. Criminal force assault have been included under 128 to 136 BNS, and false evidence under 227 to 246 BNS. There are few other updates which I would like to upload in the next videos under part 2 and part 3. For now, you need to remember these 5 recent updates. Thank you for listening. All the best. Also, do not forget to subscribe our YouTube channel or text us at 8095806118 to order your 20th notebook copy edition 2. We have already received huge number of orders and critical acclaim due to our immensely popular way of representing the flowcharts and tables and compiling all 19 subjects in 700 pages. While we have reached the strike rates around 140 to 150 fairly regularly for 24 to 25 session, reaching up to 154 strike rate for NEET shift to 2024. If there is any queries, drop a text. Thank you.